welcome to our program tonight, Hospital with a Big Heart. Before we start, I'd just like to say a big thank you to David Kievsky here for providing us with this beautiful music while we've been watching the slides. David is actually originally from Australia, but has lived for more than 20 years at our main headquarters in India, and he specializes in developing the art of meditation for himself and for others through music and art. So a very unique individual, so thank you. And we'll be hearing more from him later. Just to introduce myself, my name is Julia Fithian-Adams. I've worked as a GP for many years in a deprived and multicultural area of Sheffield. I've also worked a lot with asylum seekers and refugees. From childhood, I had the desire to work either in India or Africa with poor population to help with their medical care, and was particularly interested in village outreach work. So obviously the work of this hospital is very close to my heart. I'm also particularly interested in holistic health care and improving health on a very broad level, including helping the situation within the community. I also have a lot of experience as a patient, both with modern medicine and with complementary therapy. And lastly, my practice of meditation has become essential for my own well-being. Next thing, I'd just like to ask, who's here for the first time for an event with the Janki Foundation or the Brahma Kumaris? Okay, so just one. Welcome. Two. Okay. We also do have people viewing the event by webcast, so there may be some newcomers there, so welcome to all of you also. Just to give a bit of background to the Janki Foundation, it's a UK-based charity promoting spirituality and healthcare and a human-centred approach. The charity places a lot of importance on the benefit of positive thoughts and feelings, compassion and kindness in maintaining wellness and also preventing illness. There are various publications, workshops, talks, and there's lots of networking that goes on to help people, individuals and professionals put these values into their personal lives and their practical lives. One particular objective of the Janki Foundation is actually to support this hospital that we've been seeing pictures of, regular financial support, and we're going to hear more about the hospital tonight because we have two special guests, Dr. Partap Midha, who's the medical director, and also Sujata Rati, who's a dietitian and fitness advisor at the Global Hospital and Research Centre. So I'd like to invite you both to come and join me on the stage now. Thank you. So just to give a snapshot of the hospital, it started off as a small unit, more than 25 years, on top of Mount Abu in Rajasthan in India, a very remote area, and it's developed over these years into a fully fledged modern hospital with many branches and outposts in the surrounding region. It has a particular emphasis on holistic healthcare, and we're going to hear more about that as the conversation carries on. I just wanted to share with you one thing that somebody mentioned to me who'd visited the hospital, and she was particularly touched by the fact that the hospital had been built around a tree, and the tree's in a kind of garden area in the centre, and all the building surrounds it. And her comment was that how this created an energy of love rather than an energy of fear, which you sometimes can feel when you go into hospital. From my own experience, I always sense the silence and stillness as soon as I walk in there, which is such a contrast to my experience in hospitals in this country. So I've done a little bit of homework, and I've read the annual report, which might sound a bit boring, but in fact it's very interesting, and I'd recommend you have a look at it. There are some copies at the back you can see afterwards. And in there I found a mission and vision statement. And the mission is to provide world-class, complete healthcare services responsibly and with a human touch at affordable prices. The vision: healthcare for all, irrespective of social or economic background. So at this point, I think we've heard enough from me, and I'd like to ask both of you, one by one, perhaps Dr. Partap first, what inspired you to be part of this big project?
Thank you, and good evening, and I'm very happy that you're here with us today evening. The story is, I would say, it's never-ending story, the hospital story. And this happened like magic, you know. One of our seniors, Brother Nirvair, who's the managing trustee, he had undergone bypass surgery, and I just called him to inquire about his health. And he tells me, no, we are building a hospital and you need to come to Mount Abu. And that was one line which touched my heart. He said that we need to start some kind of healthcare facility there. And I was working with the public health system in Punjab, which is the north of India. And I felt there was much to do, not only in terms of the technical skills, but the human touch. You know, I used to hear from the patients when I used to work there, no one listens to us. That was the major complaint. Whenever I would go to the round, that nurses don't listen to us. Many times the patient wants to share his dilemma, wants to share his difficulties. So I thought, let's come up with a project which the patient is the focus. It is a patient-centered hospital. Because most of us are around technology, around having highly professional people. But what does the patient need? What does the patient require? Patient requires a comfortable setting, a peaceful setting, and a caring staff. And that was what my objective when I came here. We had a very humble beginning. It was small, and we were 30 people when we started. But gradually, over the year, not only one hospital, the main hospital at Mount Abu, but we have satellite hospitals like an eye hospital, a trauma center, a rural health center, then we have health posts and vision center in the periphery, in the villages, and we also run nursing education courses. But that has grown magically, and now we are almost 600 people working at Mount Abu and Abu Road. And as a result, you know, seeing our work, we got offer from the Maharashtra government, the Bombay Municipal Corporation. We have a public-private partnership hospital there, which has been given to us for 30 years. So it's just, I feel when the intention is good, when the effort is sincere, and when the support is big, anything can happen. The magic can go on.
Thank you very much for giving us a little sense of how it all is. I'm just wondering what your personal feelings were at the beginning when you started. Did you feel confident that things could evolve and reach this high aim that you'd set?
To be honest, when I came first to Mount Abu, I felt, what am I doing? I had come from a busy place, which was a big hospital and the peripheral dispensaries, and I didn't have time to breathe there. And when I reached there, there was hardly anything for me to do. But then, we don't know what is in the future. I would say it is a divine design, and it happened, and things slowly unfolded. And I just felt that we need to do our best. And as we were seeing the slides, we were reminded about one of our sincere and committed doctors, Dr. Vinay Lakshmi. She started working at the construction site with the labor, the people who are working. She started looking after them. And then she moved over to the outreach, to the villages. So it's a kind of having love for the people who work for you, people whom you surrounded. And I would say Rajasthan is one of now the things have changed in 25 years, but those time it was one of the backward states. And then there were hardly any infrastructure. These people who live around us, the population is mostly tribal, the indigenous people. They are Gracias and Bhils. And they had not heard about a modern hospital. They had not really entered a hospital. And initially they were reluctant to come also. When they see the magnificent building and the clean corridors and nice food, they were not interested to come. But with this outreach activity and with the credibility of the hospital building up, we feel now that we have been able to accomplish much for them. And the focus has been main on empowering the patient, educating them how to live in a healthy lifestyle. Because the focus should be more on preventive and promotive healthcare rather than just be curative. So this was the concept with which we started the outreach activity. We started with one clinic, and now we have 3 clinics going to the villages.
Thank you very much. I might follow up on that in a little while, but I'd like to bring Sujata in at this point, because you've also been there from the beginning, haven't you? And I'm interested in what inspired you to be part of it.
Very good evening and Om Shanti. I remember in Julia in 1992, I was also small and hospital was small. Actually, I honestly, since my childhood, hospital or doctors I hate. Because I always think that person should be healthy, wealthy, happy. Why? We don't need doctors and hospital. That's not our cup of tea. And being as a spiritual person since childhood, I actually, this global hospital attracts me because of it's based on spirituality. I actually developed my taste because I can say like my life has started with the hospital. I grew in the hospital with the spiritual values, and as I entered in 1992, my aim was to become a pilot. Actually, it's absolutely contrast. But somehow when I saw the patient, yeah, then I understand what is the disease or sorrow behind, yeah, and I felt like if I want to start my life with something different, so this is the right place. And like now 25 years I am with the hospital, but I must tell you that I never felt that until today I am in the hospital. Such a nice vibration.
Lovely. Yeah, you're very lucky to be working in such an environment.
Yes.
I'm sure there are probably people here who work in the NHS and would appreciate that. Can you tell me if there have been any times when things haven't gone to plan, or there have been obstacles or difficulties, or has it all run really smoothly?
Of course, I think everyone should get difficulties, yeah. So then where you stand, and how you cope up with the what you have inside and what you need to develop. So in the hospital also with the patient actually, because my role is I'm handling the diet and fitness, and diet is really a very critical issue, because even doctor is a different thing, but if doctor advise or someone advise person to visit dietitian, they said no, we don't want to visit dietitian, because what she will advise, don't eat and no eat, what else? So there is something in the mind always, so that is difficulty. And when we actually motivate people how much you need and what you are eating, input and output, so that is also very difficult. But when we explain the other stories, and when we tell the future, like this would be you are, like your future is like that, excess or diseases or the like other examples, then I think 60 to 70% people, they want to follow. But yet honestly I'm telling you, as when we prescribe a diet plan, we know that 100% or 90% no one will follow that. So I'm using that take, 70-30 ratio is always there, but it's successful.
Okay, so part of it is having an understanding of where people are coming from so that you can keep your patients.
And in this field, I think I need more patience. Okay, gradually, no problem. Next month, it's opposite kind of thing.
So in a sense, your role has helped you develop spiritually as well, by the sounds of it.
Yes.
Yeah.
Exactly.
I might just ask you a bit more about the whole department that you're working in, because it's called the Wellness Centre, isn't it?
Yes, it's under one canopy, like wellness is dietetics part, diet, nutrition, fitness. Under the fitness is pranayama, breathing, yoga, aerobics, even the walk, brisk walk. There's a different kind of walk. And under the wellness is, we refer the person, I never say patient, healthy, wealthy people. We refer to Ayurveda, Panchakarma, and we do have a spiritual counselor as well as, because the motivation everyone needs, because when the people come, not only for the diet only, because we actually deal with the psychological level. Like there are so many different kind of eating pattern, emotional hunger, and to just cheat yourself kind of thing. So that time you need a spiritual counselor as well as. So under the canopy of wellness, it's kind of the journey illness to wellness. So we do have a complete setup in the Global Hospital Mount Abu, and in this case, confidently I can tell you, 100% people are getting good result.
That's great to hear. Thank you. And so just back to Dr. Partap again, I just wanted to ask you, again, what have been the challenges that you've faced in engaging with the local population? Because we've heard a little bit about the particulars to do with lifestyle. I know from my own experience as a GP that there's a whole range of different beliefs that people hold about health and illness and how to go about improving it. And particularly if you're coming across people from a different culture, and perhaps the local population, there are a lot of people from the villages, the tribals, and maybe they have different understanding about health. Wonder how you've kind of bridged that gap, or how the hospital staff have managed to find a meeting point.
See, since our strength was meditation, we were all doing meditation, and we were supported by the Brahma Kumaris organization. We thought, why not integrate this meditation into medicine? And the reason was basically, we see today more and more people falling prey to lifestyle diseases, what we call the faulty lifestyle. Today, if you look at the principal cause of illnesses is the way we live our lives. And someone said, if we defect if we correct the defects of living, the diseases would disappear of its own accord. So it's very important that we do struggle with malnourishment and tuberculosis and pregnancy issues, but then at the same time, Mount Abu is a tourist place. A lot of people come there. And we thought it would be an added advantage for that we focus on holistic lifestyle. So we focused not only for substance abuse, but the major killer today is heart disease. Young people dying of heart disease, sudden death, it's very common. And it was amazing. Who came to our rescue was the Ministry of Defense, Government of India. They also wanted to do this kind of program. And then the ministry, those days, yoga and naturopathy used to be part of the health. They supported by funding. So the Defense Institute of Physiology and Allied Sciences, the Ministry of Health and Global Hospital, they got together. And we created a hypothesis that if stress can cause problems, meditation can really solve those issues also. This was a hypothesis to begin with. And in the first program, we just had 5 patients. And then we gradually and slowly, and we were lucky that we had the big support of our former president and now late president, Dr. APJ Abdul Kalam. He was interested in this program. And he came for the first program himself. Those days he was advisor to the Ministry of Defense. So he came for that. And afterwards, wherever he went, he quoted this program. Because this was a revolutionary breakthrough. And this was not done like a story, but it was done scientifically. We selected patients who had evidence, they had proven evidence of coronary artery disease by angiography. Some of these patients were refused bypass surgery because they were not fit for surgery. Some of them were scared of surgery because they didn't want to undergo surgery. And there were some who couldn't afford surgery. So we invited all these people. And now we have a long waiting list. And then we, over a period of 2 years, we would repeat their angiograms, monitor their stress hormones, do their melatonin levels, to see. And even we did their EEGs also, to see how relaxed they were. And one amazing fact was about the meditation which we do open-eyed versus closed-eyed meditation. We found out that with open-eyed meditation, we found more relaxation. The EEG changes were much more towards relaxation. And gradually their symptom scores went down, their exercise tolerance increased, and now it's accepted everywhere. We have been hosting World Congress of Preventive and Clinical Cardiology where we give the message. So we feel if we lead a healthy lifestyle, it's very important that we need to look after our own self. I call this program a self-empowerment program. The patients need to be taught what they need to do. Most of the time it is only simple prescription. We advise exercise and they may go to a physiotherapist for detailed, but no one really looks at the patient's needs. And compliance, as Sujata was telling, compliance is so poor in terms of even regular medication for the patient. They take it easy. So once they're explained what heart disease is, what are the risk factors, how they really need to take care of their own self. And we found that we had a couple of sessions known as opening the mind session. We asked them, we had psychological questionnaires for them. What were their profile when they first heard about the heart disease? What were they passing through? What were their family situation? What was their work-related issues? So we found something or the other had gone wrong with them. And now this is accepted all over India, and we have a long waiting list of patients.
When you say it's accepted all over India, do you mean that hospitals and other areas are actually taking on board the same approach?
Hospitals, there are some partner hospitals, but most of the clinicians are always skeptical. They would not accept this program. They would rather say, okay, undergo angioplasty, undergo bypass surgery. But issue has been with the word of mouth, with the Brahma Kumaris network. Now the message is across all over the country. And even now we have people coming for primary prevention, where they had a history of heart disease in the family, or one of the parent they passed away because of the coronary artery disease. And these people don't have actual heart disease, but they really need to have primary prevention. So that kind of patients also drop in. And then we did programs for even for the clinicians. There's nothing like that. We have patented the program. It is open to everyone. Anyone can repeat this program.
Can I ask you, is there any evidence in terms of the radiology? You know, when they're looking at the arteries, just for people who don't know, the coronary angiogram, they're looking at whether there's any blockage in the arteries. And is there any evidence that this overall approach makes any difference to the blockage in the arteries?
So we did repeat their angiograms. Now, basically some of the patients are scared. We do CT angio. Yes, with CT angio we are able to create all that images, and we are able to see that they are improving. And now we are doing, since we are now become a teaching hospital, we train doctors in family medicine. So these doctors, we are giving them some kind of research topic that to see the intimal thickness, the arterial thickening. And it is a long time, but we have been able to document, and this study has been published in the Indian Heart Journal.
And have you been able to help convince the medical colleagues around the country with this kind of practical evidence, or is it still taking time?
I would say everyone understands that even after angioplasty and bypass surgery, you need to change your lifestyle. They do advise to the patient, but afterwards, what we are doing is prior to the surgery, prior to the angioplasty, we are telling them that this is an opportunity. If you do it, you'll feel good. Anyway, you have to change your lifestyle after the surgery or the angioplasty. And it's similar with diabetics. There's a large number of diabetics around. And these all need to, the only thing what we emphasize is that the medical knowledge needs to be demystified. The common man needs to know. We initially thought that diabetes or hypertension is only a disease of urban areas, but now you find people from the rural areas coming with it.
Sujata, you were mentioning yesterday you're involved in a program for diabetes patients. Is that right, that they get admitted for 5 days?
We do have a diabetes project and the program in the hospital for 5 days. Actually, you can prevent yourself from the diabetes. So it's based on diet and exercise and of course meditation as well as. And who are diabetes like type 1 and type 2 also, they can get admitted, and basically it's a more education. Even, like some people, some are in the universe also, everyone likes sweet, right? And there's a different kinds of sweets, because some people, it's uplift actually. As a dietitian, I would say like some food and fruits are really, you can uplift your mood, even if you have a dark chocolate. Yeah? So in a diabetes sense, like I especially not advise that no, not complete no. Otherwise you will get depressed. Because sweet is a good carbohydrate, but again, if you have, sweet is a good carbohydrate means, again, I want to mention about the fructose sweet, yeah? But if you want to celebrate your food, you add your exercise. There's a tick. Means we always advise like person they should go for 10,000 steps to maintain yourself. Then you have a margin to have some bite. So I would say like Dr. Pratap, our director, he always does 16 to 18,000 steps per day. Although you don't need that. But he have a margin to have a sweet. So actually you can prevent yourself from the diabetes. So we do have a project of diabetes in the hospital, and that's how I said, why people come to Global Hospital and compared to other hospitals in India, because there is such a positive hope. You will get the answers to learn your life, yeah, to move forward in your life. It's not that we are very strict. We just go with the mood. That we teach.
And you were mentioning about part of the package is learning meditation. And I was hearing about this spirituality and well-being department that you've got in the hospital. Do you want to say a little bit more about that?
We do have a spirituality and well-being department, and we must say that in all over the world, only Global Hospital has this spirituality and well-being department, and that's thanks goes to London Janki Foundation and the European director, BK Sister Janki. So we have that department, and even the poor people like villagers in their language, positive thinking course. In psychiatry department, when the people are like mental disorder or under depression, they do visit that department. Even the people who visits me for weight watchers, yeah, like heavy and heaviest body weight, because they are not motivating. They said, no, we are very comfortable with our body weight. What's your problem? So, to change their mindset also, we need a spiritual counselor. Like person wants to always look beautiful and groom themselves. So this is an inner beauty actually, spirituality and well-being department, what we have.
So you've got counselling and you've also got teaching, meditation and positive thinking.
Yeah,
yes.
and
Yes, please, go ahead.
No, I'm just saying that this department has not been only for the patient, but even the staff who work there, they also benefit from this department. Sometimes while working together, there are issues, there are problems, and then, they resolve those issues. As an administrator, if I step into, then sometimes I feel both the parties are right. But to go to someone who's trained in counseling, somehow the other issues come up, and we find that very useful for our staff. And then the other thing is for the people who come to work with us, the new staff, their orientation into spirituality. If we need to keep this flame burning, we need to orient the new staff also, the new nurses and the doctors. They may not be necessarily, because you need professional people, they may not be necessarily exposed to meditation earlier. So they need to be exposed. So this department does, it's a continuous process. So it's a strong point. As Sujata was saying, there are some of the hospitals who have departments of mind-body medicine. They are trying to connect the mind with the health. So, but our purpose was different. Yes, people who come for de-addiction programs or people who come for diabetes, everyone does have some issues with maybe at some time. So this year the theme of the WHO, the World Health Organization, is depression, let's talk. It's very important someone should be able to listen. The beauty of the counselors is that they listen for maybe 45 minutes and they speak for 5 minutes. So it's very important that there's someone. We did have even the early times, people were conducting meditation course, but to have a structured program, we have now a structured program of integrating spirituality into their healthy lifestyle. That was the focus, that we should have a specific person looking after it. Sister Nirmala is there. She did help us in designing these structured programs. And it has been good. We are very happy with the results.
Yes, I was hearing about that actually. It's worth mentioning because there is a unit I think it's a hospital in Wakefield, and Nirmala and a chaplain there worked together on spirituality and well-being, and they did some collaborative work with you, didn't they, and helped with the structure of your department.
One more addition with the spirituality and well-being, like doctors, paramedical, non-medical staff, and one more category, because in India we get workers like sweepers, housekeeping staff, even sweepers, yeah. For them also this department is working, because their husband, and it's a different scenario. So, so many results also are, output is very good.
I'm quite interested because, talking as a doctor myself, I know that the medical profession can be a bit single-minded, and sometimes it can focus in on one particular aspect, like a disease of one organ, and forget the rest. And I'm just wondering how much on board all your staff are with this concept of holistic health and wellness, and how much they get involved in referring patients to this department, or is there more work to do to kind of increase awareness of that?
See, clinicians are always skeptical. It wasn't easy to bring in Ayurveda or homeopathy. Some still don't really approve of it, some of our clinicians. But the beauty is, if the patient gets the benefit, who would deny it? This is something we need to correct in science. In science, we try to prove something and then experience it. But I feel we need to experience, and then it is automatically proved. Like I would say the Department of Magnet Therapy. It is for mobility disorder. I know of my mother who was 85. Every day she would go to magnet therapy department, but she never took a painkiller. And I know of several patients who feel benefit with magnets, with their arthritis. And so if non-pharmacological therapy can produce similar results, why not we accept that? So I feel it's something which drugs are needed. Modern medicine is essential, but for acute care, for problems like surgical issues. But for most of the medical issues, like I would say Ayurveda is good for digestive disorders. Homeopathy is good for allergic issues. So we need to understand that we do call them complementary systems of medicine. There's something good in every system, and we need to appreciate that. Once we start appreciating each other, then probably the bridges would be built. But still it hasn't happened. Homeopathy is looked like, maybe as some people say, it's quackery. I say probably the beautiful part, even in the magnet therapy, I feel, it is the healer himself. It depends upon the person who's giving the healing. He is such committed, and I always tell him that more than the magnet therapy, you also work.
Yeah. Have you invited your members of staff to come and experience these different therapies?
No, members of the staff, particularly the nursing staff, they always go there.
Yeah.
And even these doctors, we have used magnets for stroke patients, for patients with cerebral palsy. And they do know, because there are certain things with which, like for cerebral palsy, we would only advise physiotherapy. But with magnets, if the patient is able to do something of his own. So that's very important. I remember, it's very important. We need to understand the most powerful thing is the mind. If the mind accepts something, it happens. I was in Miami. There I he was not I would say physician, but he was a clinical psychologist. He was treating patients with spinal injuries who were paralyzed, bedridden, with biofeedback. And his studies were published in the Lancet. And I did meet him when I went to Miami, and he said, it is probably the patient is being skilled. He said, if there are some neural fibers intact, they can take over the function of the other neural fibers. So it's the mind which needs to understand that something can be done about it, and I have to do it. Like when we say hospital with the heart, I always feel heart is a muscular organ. But the compassion, the care, the love, and listening with attention, that makes all the difference. Because you need to accept the patient. And I don't know about Great Britain, but I know about India. Sometimes the doctors would get irritated also. They would say, "Oh, I am the doctor, you are the patient." They would not answer all the questions.
It's very true. I mean, that's part of one's spiritual growth, you know, as a clinician, isn't it? To learn to overcome your own ego about that. And
these days people come with having read everything in the Google about their disease. They know more than the doctor because they might have even gone to the latest thing. But I feel the most important thing is patient empowerment. Patient needs to take charge of his life. Simple things like if you educate the patient what kind of food he should take, particularly asthmatic children. And it was done when they were educated about their asthma, their emergency room admissions became less. Just simple education. I was in Boston, there I met a nurse. She had written a book, Prepare for Surgery. And what she was doing was she was teaching patients 3 days prior to surgery, meditation, relaxation, exercise, and other things. She has been to Mount Abu also. And she said that this could give amazing results because everyone today in the health system thinks of cost. If the cost can be brought down by simple these relaxation exercises, why not we accept it?
I'd like to just go back to an area which I was moving towards earlier on, which is to do with the tribal population who are obviously living in quite poor conditions. And sometimes these spiritual ideas can be seen as a bit of a luxury when you're thinking about where your next meal's coming from and how you're going to keep your family together and a roof over your head. So just in terms of the diseases of poverty, like tuberculosis that you mentioned, how have you been able to engage with the poorer population who have perhaps little or no education and may have their own understanding of what this disease is and what should be done about it? How have you managed to meet them?
See, everyone has his issues. These people still are very traditional. They have their own belief system. What we tried to do was, that again was done by a Dutch nurse, Matilda, I know you met her. She started learning Hindi and someone is helping. We started, these tribal patients, we started teaching them positive thinking. We didn't talk of meditation. Just what are the thoughts? Everyone understand that. And they were receptive. But as far as the lifestyle is concerned, the nutrition is concerned, we need to really support them. We are supporting many villages and schools, particularly the school-going children. And now we are starting a program for under 5 children to give them nutritional supplements. So health is a very complex issue. It is not only, you need clean water, you need hygienic surroundings, all those things. It's a long journey, arduous process but we do measure. I always tell my doctors that we need to measure what is the impact which we are making to their lives. What are the education level of these children's schooling? Has their, study standards improved? Has their weight increased? Whether their height is... We do try to see whether our nutritional programs, our educational programs are making any impact on the school children.
Yes, because I was reading that you actually do provide nutrition for the children, don't you? And that's also part of the thing that helps encourage them to come to school and get their education.
Even for tuberculosis patients, now the government is awakening up. I was studying, we have been doing it, not just medicines, but they need some kind of nutritional supplement. We give them roasted chickpeas or some peanuts with the medicine. Because it's not just the disease, but the patient needs to be, really be strong enough to fight the disease. As you know, tuberculosis can lie dormant for years together in the body. It's only when we are under stress or our nutrition is in jeopardy that disease crops up.
Yes, I noticed actually when I was reading the report how many different projects you seem to have in terms of helping people in their education, helping them in employment, and helping general awareness. It's a lot of community work, isn't there? I wonder whether you can give a little bit more detail about that.
No, I always tell that this is a hospital without walls. We reach out to the community. Our focus has been more on children. We do pediatric ophthalmology, we do the reconstructive surgery for the children, we do the school health screening programs, and then we reach out to the people in the villages to educate them. You know, we were lucky that we stumbled upon something known as healthphone.org. Now our field workers have a chip in their mobile phones. Mobile phones are very popular. So they go with the small clippings, small video clips, which they would show to mother, to the children. Maybe it is on immunization, maybe it's on right diet, breastfeeding, and diarrhea, oral rehydration solutions. Likewise, there are almost maybe 200. So, and then what they have done is, at the end of the video click, they have some celebrity speaking about that. So it really catches with people. So they go with the mobile phone, show the... But I feel it has to be an integrated approach. Everything needs to be taken care. Nutrition needs to be taken care. The surrounding needs to be clean. They need to have proper housing, which is happening, but it's on a very slow pace.
I remember, actually, I did go out on the village outreach project with Veena Lakshmi when she was running it, and the thing that struck me was, as soon as the vehicle arrived, all the children came running, and they wanted to prove that they'd washed their face before she got there, because she told them that they had to wash their face. So it's like little bits of education. Yeah. Just again on this subject of helping the community, I was also interested to see about the development of the School of Nursing and how it's drawing on the local population to train nurses. So not only are you gaining as a hospital, but it's also providing employment in the long run.
See, the beauty is we try to focus more on girls. We try to take more girl students in the nursing. But now in India, the nursing is accepted as a very rewarding profession. So a lot of boys also come for the nursing. And we started with the diploma course. Now we have a degree course. We plan to do a postgraduate course in nursing. It's very rewarding in the sense that nurses are in acute shortage all over the world. So we are able to not only employ them in our hospital, but then there are other hospitals in the cities which are looking towards our nurses. And they get good remuneration, good employment. And slowly even the tribal girls are coming. We do regular career counseling. We go to the schools and tell them that this is an option available to them. And we have introduced some scholarships to promote for the poor people. We were helped by one of the foundation in Holland, which was supporting some of the nursing scholarships. So and nursing is the key area. They are the one who spend most of the time with the patient. The doctors would only come and go. And they need to be trained well. They need to be trained like we are using the Vihasa model for them. And it's a slow going, but we are making changes in their working style.
You just mentioned Vihasa. I wonder whether, do you know about the Vihasa? Could you explain that for everyone what it is? Or would you rather Dr. Partap?
Yeah.
Okay.
Well, this is a program which has been developed in UK by Janki Foundation with our professional colleagues. And this is values in healthcare, a spiritual approach. And the focus is more on experiential. It's not a didactic program, but people have to bring in their values and how they use it for their professional work. And it's a very simple program. But wherever we have conducted, not only for our staff, but even for the other hospitals, we found it quite receptive. And people, their core values such as peace, positivity, cooperation, compassion, and then the most important is self-care. You know, the doctors and nurses, they need to look after themselves also.
It's very true. That was something that I was going to touch on, because when I've been into the hospital, I've felt it's very peaceful, but I know things can be different behind the scenes. And I was just wondering, you know, when times get stressful, sometimes there's an emergency, how do they all cope?
See, well, once you have created an environment where people talk softly, so it gradually creeps into everyone. But we do have difficulties. We need to get down and resolve our issues. These days, you have accreditation standards, you need to have clinical audits, you need to have some kind of appraisals, everything you need to do. And you need to have patient safety standards. All these issues, sometimes we do have problems, but then those problems need to be addressed by talking, by bringing more and more people into your fold. There's so many standards, there's so many criteria which we need to fulfill. And it's the most important thing is being aware of something. If you're aware of what are the patient safety standards, even the housekeeping staff or people working in the kitchen, they need to be educated about these things. So we do try and do that. And staff is the core issue. When you were saying about the challenges, my challenges are finding the right staff, finding the right clinicians. Sometimes, like recently my pediatrician left, and I have a hard time finding another pediatrician. Someone may be willing to join us.
Yes, I was going to ask about that. How do you attract staff to come to this remote place where perhaps it's not a good career move?
Very difficult.
Yeah.
You have to, you have to advertise, you have to write in the medical journals, and then you have to interview several people, and then only you find the right person.
And then it's about keeping them, isn't it? And, because the working environment is beautiful on a physical level, but it's
love the place. We have been lucky in some areas, like our ophthalmologists. There's some people who have stayed with us for more than 20 years, and they're still working with us. And then our ENT surgeon, our anesthetist. But in some areas we have not been that fortunate, like a surgeon or a pediatrician. We have been having regular changes. So it's like looking for the right kind of people and the right kind of environment. It has to be a match.
Yeah.
And most of the people enjoy working in a small place because the challenges are less. Working in a big place, the challenges are much more.
I might just ask Sujata at this point, because you're a clinician working on the ground, as it were, what your experiences of how everybody gets on together as a team, or are there problems and people have to resolve things?
Actually, being in the hospital, I was just thinking while conversation is happening, it's kind of you are in a defense. It's like every day you need to remember your mission and vision. Yeah, to working and handling with the different difficult tasks, even with the staff, with the recruitment, as he was mentioning about that. The attraction is Mount Abu hill station is a very popular, because so many hill stations in India, they are very commercialized. But this hill station is not commercialized. And the main is Brahma Kumaris headquarters. So it's the spiritual vibes. The people, they feel actually as they touch the land of Mount Abu, spiritual vibes. Some people are really, they attract with that, and they want to come and work in the hospital. But some people, they want to go out because there are no any social engagements. So it's all about the person's choice actually. Like some person, like here in Oxfordale, near Leeds, the people are very happy there. They don't want to come in Times Square in New York or somewhere else. But they're very happy, and they are leading a quality of life. So it's, again, I would say, is a person's choice.
Yeah, so you're really attracting people who are going to contribute to that kind of atmosphere.
Yes.
So that they're more likely to be people who want to harmonise by the sounds of it.
Yes.
Yeah. Okay. And could you tell me about what proportion do you think meditate out of the staff?
In the staff? Actually, yes, we do have our principles being in the hospital. No matter person is spiritual or non-spiritual, as in outside hospital also we pray. Like everyone before start the work, before their work, they do 5-minute meditation. We do have a meditation room there. Or if they are not able to visit meditation room, at their desk also, before start their work, they just remember, because we play music with that. And for the other part of the spirituality, like we all do Brahma Muhurat, like meditation, early morning meditation. That really gives mental health. Yeah, mental health, and you are very much focused about you, and you know you are not pretending anything. That meditation teaches. So in our hospital, 80% people are following that. I am not telling you 100%, 80% people. And there are spiritual gatherings are happening after. It's a very nice, beautiful combination between professionalism and spirituality. Yeah, it's really nice. Like in profession level, you bring your spiritual values, like sweetness, or you have that quality to listen. Yeah, so that meets. So that's all about that.
I'm interested to know, actually, as you're describing this, I know because I practice this myself, that with the Brahma Kumaris do 1-minute meditations on the hour. Do you do that in the hospital while you're working?
Actually, this is a very good question. At the personal level, some few people, they correct themselves. Like we always say, in not 1 hour, 1-minute meditation, actually we say after 2 hours, stretch yourself as fitness level. Yeah? So exactly like that, some people, they do in 1 hour, 1-minute meditation to just recharge yourself. And I add that in breathing.
Okay.
Take a deep breath, exhale, and get recharged.
I think just in response to a couple of the comments, the most important thing that you're offering at your hospital is the overall approach, isn't it? So it's not like you're saying one thing over and above another one is better, but all angles, modern medicine.
The message should go across that we are not trying to undermine the modern medicine. Modern medicine is needed and it is vital for our health. But I would say, if we are open in our approach, if we focus on lifestyle, if we focus on exercise, right type of diet, and meditation for stress management, I think it would be a great benefit. It would be a synergistic response and people would benefit much more. And we need to be open to all the remedies, open to all the suggestions, and we can put it under scientific scan. And this is happening, as you were saying. There are so many studies. If you look at the meditation, you'll find at least hundreds of studies. Now, in some of the medical schools in America, they are teaching spirituality to the students, although it hasn't happened in India. Almost 90% of the schools in America, they feel that spirituality is relevant to our lifestyle. Spirituality is relevant to our healing. But it has to happen on a, the policy makers, the people who design the courses, they need to pay attention to it. Because I remember as a student, when I was way back in 60s, no one even taught us about diet.
So things have come a long way, haven't they?
So it's now the things are, yes, scientific evidence is needed, but we need to be open to suggestions.
Thank you. Okay, so now we have a little surprise for you, because we haven't yet, I think, mentioned that Sujata, not only is she a dietitian, but she leads fitness activities for groups, but particularly within your work in the Wellness Centre. So we're going to give you a chance to experience her expertise just for a few minutes.
Julia, ask everyone that would they like to do.
If you feel happy to do, no obligations. You can at least watch if you don't want to join in. Yeah, some yeses. Okay.
Yes.
Just before we go ahead with that part, I did forget to mention at the beginning that photographs are being taken and there's some filming going on because we're on the webcast. So if anybody feels uncomfortable with that and they prefer not to appear on any photos or on the film, please let one of the ushers know. So just before we do the exercise, it would be nice if we all were to have a minute's silent reflection together, just to absorb everything that's been covered so far. Thank you. So thank you both very much for your contributions. You've taught us a lot this evening.